All right, welcome into Good Life Family Chiropractic, guys. This is Dr. Jake Tucker. Once again, welcoming you into another educational video. This is my lovely wife, Kirsten. As you can see, she's about 9 months pregnant. And today I want to teach you about a question that I get asked a lot, and that's, Dr. Jake, when is it most important to get adjusted? And is it safe for a pregnant person to get adjusted? And obviously there's a lot of complexities involved with pregnancy, 9 months of variation in just hormones and structurally with the ligaments and how the bones hold themselves together on top of the discs. But what I want to talk about today is specifically the importance of why babies should get adjusted in utero, and that has to do specifically with the nervous system. Now, I'm not actually going to adjust my child in there, but what I'm going to do is I'm going to focus on opening up the sacrum to relieve any pressure that may be on the nerves that go out from the sacrum to the uterus and the ovaries there that are aiding in the production of healthy hormones, such as relaxin, that helps to open that up. Now, I get told a lot that sacrum, that back side of the birth canal, that gets too small, that some women just have a birth canal that's too small. And often the reason why that is because the sacrum is tilted too far forward, and that's due to too much sitting. When you sit down, you lose that curve in your low back, and the sacrum starts to tilt forward. And so we have an adjustment specifically for that, to open up the birth canal, start to take pressure off of those nerves, and allow not just my wife to feel a whole heck of a lot better. This is for something like sciatica or low back pain, where the pregnant patient actually feels the pain of that pinching on those nerves, but it also opens up the same nerves that go over to the uterus as well. And so all we do is we have pregnancy pillows here. You can see there's 2 of them because of the size. If you're a beginner pregnancy mama, that would be the smaller pillow. We have the larger pillow, and then when we get to that size, we go to 2 pregnancy pillows. We have the pregnant patient lay face down, so go ahead. In order to aid in the biomechanics of the adjustment, we also put a roll on her forehead so that she's not letting her head fall too far forward. Now, how comfortable are you in this position, Kirsten?
That's good.
Good. And no other time during the last couple months of pregnancy can you lay on your belly unless you're on a table that drops away or pillows just like this. What they have is a cutaway in between there. And so what I want to do is I want to see the tension in her sacrum to see where the pressure is first. And you can see, if you look straight down, that her right leg is not going as far forward as her left leg is. And so that indicates a tightness in the sacrotuberous ligament here, meaning that her sacrum is being pulled over to that side and forward on that side. And so there's a number of ways that I can address that. I can do a traditional side posture adjustment and really drop into it, which some patients consider a little bit more violent than they'd like to have adjusted while pregnant. So I usually go with a tool such as the arthrostem to help open that up, or I can use something like my thumb. So I'm going to demonstrate the thumb adjustment. And what that is I'm going to go ahead and put my opposite hand thumb into there and just allow that to kind of massage into that ligament. And I'm going to rock the spine back and forth here. Now, this style of adjusting is called the Logan technique, named after the doctor that founded the Logan College of Chiropractic in St. Louis. And there are a lot of Logan-specific practitioners, but pregnant patients love this, as my wife will attest. It feels very much like a massage. And I'm going to work my way up the entire spine, because what I'm doing here is I'm promoting the flow of cerebrospinal fluid through her entire spine by just making sure that she has proper motion through each of those vertebrae. Cerebrospinal fluid is essentially the blood of the spinal cord, bringing nutrients to every single segment, every level of the spinal cord. Get up all the way to the top, and I'm going to accelerate here because this is an example, although she does need this adjustment as well. We saw that with the tension in the sacrum. Get all the way up to the top, and we go all the way out there. And so now when we check her sacrum, it should be much more relaxed on the right side. You can see that that's actually balanced there. Now the other thing I want to check for while she's face down is if the sacrum is cocked over to one side or the other as well. And so I'm going to have her keep her knee straight, go ahead and lift that straight up on the right side, and then we'll note the height of that, and then switch legs. And you'll see that the left side is actually going slightly higher, and so that means that it's still tight. Well, this will come in here and just slightly input onto that, and then we'll check and make sure that comes up a little bit higher. Go ahead the other side. Very good. And that's balanced now. So that's exactly where we want sacrum to sit in order to open up that birth canal. Now I'm going to have her flip over on her back. And what we want to check here is those round ligaments. The round ligaments attach at the front of the sacrum and go over to the uterus, actually attached to the uterus. And so if one side is tighter than the other, or both sides are tightened down, that affects how baby lies within that pelvic girdle. So I'm going to come in here, so a little bit below the belly button, and find those round ligaments. And so the right side over here is tighter than the left side. Now, oftentimes, and what I'm doing here is just holding down gentle pressure, almost massaging again, trying to get that round ligament to relax. It has tiny muscle fibers in there. It's one of the few ligaments in the body that actually has muscle fibers. Once I get that to relax, that actually allows the uterus to fully open up. Now, when one side is tighter than the other, and that corresponds to the side of sacrum that's rotated back, oftentimes what we'll get is a breech position baby because the pelvic girdle and the birth canal have not opened up fully to allow baby to drop head down into that vertex position. And so we want that vertex position so that you can have a natural, easy childbirth, the way that your body was designed to. But when those are tightened down, it doesn't allow baby to drop head down. Now the last thing that I want to do is I want to finish off activating the parasympathetic nerves, the rest and digest nerves. And those are indicated here by the blue nerves. And so these are also considered the craniosacral nerves. And so I want to check the nerves at the top of the neck to see how they're functioning. And you can see that the left leg is slightly short in this way. And so I'll come in here and I can adjust this either by instrument or hand. And so she's off at C2 on the left side and C1 on the right hand side, which oftentimes those bones will subluxate opposite one another to compensate for the misalignments. Just like that. Just like that. Double check to make sure that we got it all. And that's the adjustment. Thank you for tuning in. Another production of Good Life Family Chiropractic.